Welcome to Fertility Friendly Food, the podcast. My name is Stephanie Vlakis and I'm an expert certified fertility dietitian and nutritionist and founder of The Dietologist, a multiple award-winning virtual fertility and pregnancy nutrition clinic serving thousands from around the world, and of course, the host of this pod, Fertility Friendly Food. This podcast is dedicated to all things health and nutrition in the world of fertility, reproductive health, and pregnancy. Each week, I bring you practical snack-sized episodes to help improve your lifestyle on your trying to conceive journey, alongside guest expert interviews to help inspire you to learn and grow whilst you grow your family. This episode is brought to you by our Endometriosis Nutrition Coaching Program, a bespoke 4-month one-on-one experience combining one-on-one consultations via Zoom from wherever you are in the world, 24/7 access to online learning, and weekly support from a trained endometriosis dietitian and nutritionist to support you with your endometriosis goals. We use our signature approach focusing on inflammation, hormone health, and gut function to improve your quality of life. We have openings available each month for endo warriors who are ready to commit to expert nutrition support to tackle these bothersome symptoms with science, practical tips, and compassion, and without the BS. The link is in our show notes to apply to work with us inside our endo nutrition coaching program. Myself and the dietologist team cannot wait to chat with you soon. Welcome back to the 5th and final episode of our Endometriosis Mini Series for Endometriosis Awareness Month. I hope you've enjoyed the previous episodes this month and you found this mini series educational, inspiring, or helpful on your path. Now, this episode is a bit of an update or flashback about my own endometriosis story to date in honor of March being Endo Awareness Month. And I know a few years ago I have recorded this, and honestly, I rarely listen back to my own podcast episodes, but this one I have a couple of times, in fact, and it is such a time capsule for me after my diagnosis. So if you want to, you're welcome to go back and have a listen to that particular episode. I've linked it in the show notes for you below. You'll notice that in season 1, I was pre my sinus surgery and my voice has changed a lot, thankfully, for the better. So honestly, I was inspired to record this episode, not to be self-indulgent, but because since I released the podcast episode back in early 2020, and I've featured in other podcasts, I have received messages and had conversations with people discussing how my story and sharing my symptoms has helped them get an answer and get their own diagnosis of endometriosis or another condition that they didn't know that they were aware that they were living with, or were all those bothersome symptoms that they couldn't quite put their finger on. So I wanted to update you a decade on from when all my symptoms began with endometriosis, what that looked like, how I navigated the medical system to finally get a diagnosis, and what my life has looked like now, a few years after my laparoscopy and excision surgery, and how I personally manage my endometriosis to date. Now, it goes without saying that I am not a doctor or a medical practitioner, and I am not sharing this as advice as a healthcare provider. I am sharing my own personal story, and I happen to be a healthcare provider with this platform, and I feel called to share my story with you. Just because I did something at a particular point in time doesn't mean it was the quote-unquote right or recommended thing to do. A lot of what unfolded occurred before I was qualified, and certainly before I knew as much as I know today about endometriosis. But hey, that's hindsight's 2020, isn't it? The way I'm going to do this podcast episode is almost like I'm interviewing myself and ask some of the questions that I most commonly get. But before we kick off, as per usual, let's answer a question from our community. So if you would like to submit a question to the pod, please feel free in the 30-second question form linked in the show notes for you. We absolutely love receiving them. It doesn't have to be about endometriosis. It can be about any reproductive health or nutrition concern that you would like to have me answer in a longer format. So today we have a question from a listener, and she says, I know it may be a sensitive question given many listeners may not yet have been lucky enough to have had their first baby or to successfully breastfeed, but I'd love to know what you'd recommend from a fertility nutrition perspective for longer-term breastfeeding mums who want to conceive again, and what nutrients should we be focusing on? What a fabulous question. And I do intend to create a specific podcast episode all about trying to conceive whilst breastfeeding, because increasingly, as we've been around for more years, we see a number of our clients returning for second and third and beyond children, and many of them wish to continue breastfeeding their bubs. So this is a really tricky and it's a really difficult area to navigate because of how individualized it can be. And so I guess we just need to visit breastfeeding physiology just briefly, which is breastfeeding is triggered really by the brain and the hormone prolactin, as well as, of course, baby's latch and suckling to drain the breast helps trigger more breast milk supply. Now, when prolactin levels are higher, the body can suppress reproduction. And this is an evolutionary trait to basically preserve mum's energy. And it's a time, biologically speaking, where typically the body's trying not to conceive. And that's why often we hear, breastfeeding is quote unquote a natural contraceptive option. But it isn't foolproof because you never know what month you could start ovulating again. So good signs to look for when it comes to wanting to maintain breastfeeding and trying to conceive is the return of your menstrual cycle and also confirming ovulation is occurring. There's a number of different ways you can do that, but I encourage you to reach out to at least your GP, but if you've got an obstetrician or fertility specialist, even better, to get some confirmation about that. And if you do not have your menstrual cycle back and you are unable to confirm that you are ovulating, then it is a question as to waiting until you have reduced breastfeeding or bub has reduced breastfeeding accordingly. Or sometimes there may be some medical interventions that can be applied. Now, nutritionally, what do we commonly see as a big barrier is breastfeeding mums undernourishing themselves. Breastfeeding nutrition requirements are actually higher than pregnancy requirements. And so you do need a significant amount more energy each and every day, and particularly foods from grains, vegetables as well, and a slightly less protein focus compared to pregnancy. And so most clients that we see postpartum or breastfeeding or busy mums, they typically are not eating adequately or regularly, or they're kind of doing this on the go style eating of a piece of toast here and there, but not really ever sitting down to a proper balanced meal. And that undernutrition combined with the high prolactin kind of gives this suppression effect to the cycle again. In some cases, and not all cases, but certainly in some cases, I have seen that the re-establishment of ovulation in the menstrual cycle does not occur until breastfeeding has stopped completely, which obviously if you and your baby are not ready for, then you either need to delay trying to conceive further, or if trying to conceive is a higher priority for age or medical reasons or whatever, then that's a conversation that you need to explore with your own healthcare team. But it is one of those situations where it is possible to quote unquote get your way in every situation, but in some clinical scenarios it's not. And I think we got to be careful about popularizing or, glamorizing trying to conceive and breastfeeding, and also breastfeeding whilst pregnant and so on. Whilst it's certainly possible and does happen, it may not be the outcome that you will get. So I think that's a really important thing to note. And it's quite a unique clinical situation to be pregnant and breastfeeding as well. It requires a lot of attention and care. So hopefully that answers your question. And yeah, definitely we will get onto an episode about trying to conceive and breastfeeding. Now, back to my endometriosis story. 10 years on, the fifth and final installment of the 2023 Endometriosis Mini Series. So let's flash back 10 years ago. I was about 18, 19, and at about age 18, I started the oral contraceptive pill after an embryo physiology lecture in second year uni. I decided, wow, there is no chances that I will be taking, and I want to make sure I was protected from unintentional pregnancy. I was also suffering with hormonal acne at the time, which I thought perhaps could be in part improved by the pill too. I got the pill without much issue from my GP. And also just before this, I had navigated a 3-month delay to a diagnosis of asthma. Yep, at the age of 18. Things were pretty bad. I was taken to the emergency room a couple times. I later found out that I had severe eosinophilic asthma, which affects about 5% of all asthma sufferers and is a dysfunction of the immune system where white blood cells called eosinophils deposit in the lungs, and that causes irritation and to create asthma-like symptoms. For me, that was a lot of late night coughing, wheezing, trouble breathing when exercising. The cause of why eosinophils rise is still not yet known. It's not an allergy or a particular environmental trigger that we're aware of. But I think this immune system disorder is certainly interesting in light of endometriosis, as we do know that endometriosis does involve some kind of immune dysfunction to allow those endometrial-like cells growing wherever they like in the body, right? Like the immune system has fallen over somewhere, or endometriosis is so clever that it can alter the immune function to allow it to grow. Anyway, back to the pill. Prior to the pill, I didn't have many issues with my period. I got my first period at age 13. I don't recall being in significant pain. I don't remember heavy bleeding. I had irregular cycles at the time, but it all evened out as I got older. I was constantly going to the GP, worried about my irregular cycles, and constantly being screened for PCOS because of my acne and my wacky cycles, but everything always came back all clear. I remember as I got older, my period length getting shorter, which isn't a traditional sign or symptom with endometriosis, but it's just something I notice quite a lot amongst my endo clients is having shorter cycles, like 24 to 26 days. Doesn't sound like much, but that might be an extra 1 to 2 menstrual bleeds a year. And perhaps harks back to this theory of a higher lifelong estrogen exposure, that is having periods start earlier in your life and going through menopause later in your life. So you're having more menstrual cycles across life and more surges of estrogen across your life may be part of why endometriosis comes about. Although I feel like that theory is quite weak, but it's interesting observation nonetheless. But I never really thought much of it really. I just recognized it was somewhat normal to have sometimes longer cycles, sometimes shorter cycles as an adolescent, and it was never a really big pattern for me. What ended up happening at around 18, 19 is that I ended up in my GP's office before a dance concert, as I wanted to skip my sugar pills on the pill packet to avoid a bleed during that time, because there is nothing more uncomfortable than a G-string tampon split combination, okay? If you know, you know. It's not a fun time. If you can avoid it, you try to. So I wanted to know, could I just run all the active pills together? And they advised me, yep, that was fine if I wished. And my doctor at the time reminded me to use the sugar pills every 3 months or so. But if I wanted to delay it for a week or two, not a problem. So I did. I ran all the active pills together. But sadly, despite doing that, I still bled. Dance concert be damned. It was really confusing at the time and frustrating, as I knew technically the hormonal withdrawal should cause the bleed, but I was still using the active pills, so nothing was being withdrawn. So I returned to my GP to update them. Their recommendation at this time was to switch pills to one that is called a triphasic pill, and that has 3 different types of pills. So each week you get a different dose of the hormones and then the sugar pills for the 4th week. So it scaled up in dosage from week 1 to week 2, and then week 2 to week 3, and then week 4 was sugar pills. And my GP's advice was not to skip the sugar pills on this particular pill. Whenever my sugar pills are due, you just had to take them. This ended up working for quite some time, actually years, without any breakthrough bleeding, which I was stoked about. But it also left me very little flexibility to manipulate when I could have my period, which I kind of just tolerated. It was more from a lifestyle perspective, not so much pain. So what happened after this? Well, it was 2017 at this point. I was in my final year of training as a dietitian, and that involved placement, which is kind of like on-the-job training, but everyone is examining you and assessing you, making sure you're competent as a future dietitian, and nobody's paying you. In fact, you're paying them. So safe to say it's a high-stress environment. And I did notice one weekend some right-sided lower pain, which is medically typically referred to as right iliac fossa pain or RIF pain. I spent the weekend in bed. It was not death-defying, but it was dull and constant enough for me to give the nurse on call hotline a call, so Health Direct for my fellow Aussies, and they recommended seeing a GP, which this time it was certainly easier said than done on placement. So I couldn't see my regular GP because they worked Monday to Friday and I was working Monday to Friday, and I couldn't get there before or after hours with the opening time. So I decided to see a local GP that was close by to my regular placement. So not my usual GP. They became concerned that it was appendicitis with the description of the right-sided pain I was having, which was what the nurse on call had warned me about. So I sent off for a delightful ultrasound, and surprise, it was my very first transvaginal or internal ultrasound, my very first date with Wanda, as me and my clients like to call her, and I was not exactly expecting needing an internal ultrasound to see my appendix. So the sonographer that I had was not particularly delightful. She didn't really prepare me or warn me very well, and she certainly wasn't asking if I was okay or how I was feeling. She kind of just got in there and scrounged around, for lack of a better term. Now, I will say that's not the norm. I've had several other internal ultrasounds after that, and all the sonographers have been incredible, asking how I'm feeling and so on. So I don't want to scare anybody, but anyway, this was just my experience. So I was nearly crying from pain in this scan. Anytime she leaned towards the right ovary, it was so tender and sore internally. But at the time, I just turned my head into the wall and kind of cried and winced silently into that wall. She didn't really want to deal with me complaining. It was evident. And I was sent back to my GP, who said everything was fine. It might be just some right ovarian pain, and to come back next month if I need some more help, which I was pretty infuriated by. We also did, I think, some urine testing, which had blood in it because I was on my period at this point. And apparently that was a shocking revelation. And I just assumed that, it's pretty normal to have blood in your urine when you're on your period, and I am a menstruating female, so it's a safe assumption that that's what that was. So I had to do another one of those tests, and I also then mentioned the pain in the ultrasound, which I didn't think was too relevant. I just had never experienced an internal ultrasound before, so I didn't know if it should hurt or not, but I did mention it to the GP at that point, which definitely made their ears prick up a little bit more, but they still sent me on my way. I came back about 2 days later complaining that the pain was still there. And at this point, I had thought a bit more about it, and I just thought, goodness, there are so many organs in that region, not just my appendix and my ovaries. There's also my bowel, my kidneys, could it be referred pain from the bladder, and more. So I wanted to make sure nothing else was going on. I was sent for an abdominal x-ray at this stage, and this showed fecal loading, which basically is the clinical term for constipation, which really baffled me as I was opening my bowels daily with no issues. So how could my bowel be full of actual poop? Mind-blowing to me. So my GP prescribed stool softeners to clear things out and set me on my way, advised me to drink lots of water and eat some more fibre, which was a bit of an eye roll moment for me. I was doing just fine on both of those fronts as a student dietitian. I truly believe there is no time where you pay more attention to your diet and lifestyle than when you're a student dietitian. And I can certainly tell you this was not lifestyle related. This seemed to temporarily help the stool softeners. It took the pressure off that right-sided pain, but not completely. I got through my placement, I returned to my usual GP to update them and let them know what's going on, plus the fact that my bowels and my general digestive function had deteriorated. At the time, myself and many of my colleagues and friends were suffering with funky bowels, and we all thought it was related to stress. Naturally, we coined it placement bowels as a bit of a joke. But I mentioned what was going on to my GP, issues of constipation, diarrhea, significant bloating and abdominal distension, and she referred me to a gastroenterologist for review after some testing of celiac disease. And the relevant context here was at this time, I was also found to be iron deficient, which I tried my best to manage with iron supplementation, but it was worsening my gut concerns so much that I struggled to really keep anything that was going to make a significant difference to my iron levels down. So what investigations and what diagnoses did I receive along the way? Well, so far I've had an ultrasound, an abdominal x-ray, some blood tests, some celiac testing, some iron testing, urine analysis. And I mean, if I think back to other parts of this journey, which feel like a bit of black holes, I did more ultrasounds, I did pap smears, I did so many things. But anyway, at this point in the journey, I was about to head to the gastroenterologist who understood I was doing what I could with my lifestyle, manage my symptoms, and could see right away that something medical was definitely going on. He was quite suspicious of Crohn's disease, which is a form of inflammatory bowel disease, or a gynecological concern, which I asked him what could that be, and he said endometriosis, a word that I had started to become more familiar with earlier in my journey. I had mentioned this to my GP, but she basically just said, it's not possible to have endometriosis whilst you're on the pill, and I would just know because the symptoms are bad, and the treatment anyway for endometriosis is the pill, so how could it be possible for it to grow on the pill anyway since I've been on it for this time? Now, everything I just said is untrue, unfactual information, so erase all that from your mind, but this was the misinformation that I was originally given, and I knew no better at this point and took her word for it, and I didn't completely let it go, but it certainly planted seeds of doubt that this was a likely explanation for what I was experiencing, but I did start to become more and more familiar with it. Anyway, back to the gastroenterologist. He wanted me to go for a colonoscopy, and it took a little while to get in for a publicly funded one, as advised, and mostly I had no money at this point. I was just finishing my placements and about to go out and try and get a job. I had no money to go private, and I actually ended up cancelling my name off the list for a colonoscopy at some stage. As my stress had eased, I felt so much better. I thought that this was the solution. It was just all this stress that it was causing me. That was what's caused the bowel dysfunction. And of course, the symptoms came back shortly after, and I had to reschedule it again and wait again. Oopsies on my behalf. So don't gaslight yourself out of just doing the test, please. Learn from my mistakes. I did my colonoscopy. They found nothing besides an ulcer in my terminal ileum. Now, this is the narrowest part of the gut and is the most common site for a bowel obstruction. And it's also the very tippy end of the small intestine before it feeds into the large intestine. And its location is exactly where I was having my pain, in that right iliac fossa area. It's also primarily responsible for vitamin B12, and it is an extremely common site for Crohn's disease to be found. But there was no Crohn's found. The gut lining was intact. It wasn't inflamed. My inflammatory markers were normal. It was only an ulcer. No treatment is available for this kind of ulcer. And the rest of my symptoms of bloating, gas, diarrhea, constipation could be explained by irritable bowel syndrome, or IBS. So let's add the colonoscopy to my list of tests and IBS to misdiagnosis number, I don't know what to list. We've gone from right ovarian pain to potential Crohn's disease to IBS, and I'll explain later why this is a misdiagnosis. So at this point, I went, okay, that chapter's closed. I set off on managing my IBS. I wasn't an expert at this stage as a new dietitian, so I was chatting to a few colleagues, did my own learning to navigate myself through the low FODMAP diet. We do have an episode talking you through that from a couple weeks back with our team dietitian Kaylee, so I'll leave the low FODMAP diet for endo episode linked for you in the show notes. Now, it wasn't fun, but with some preparation, grit and support, I got through it and found out my triggers, which were mannitol, which are commonly found in mushrooms and cauliflower, amongst a number of other foods, and also an excessive amount of GOS, or galacto-oligosaccharides, which are commonly found in legumes and beans, amongst other foods. So I reduced these to a manageable amount and lived relatively bowel symptom free for about 6 or so months. At this point, it was mid-2018. I became suspicious something else was going on. I started to notice some pain with sexual intercourse, but I couldn't quite put my finger on it. And I was starting to experience breakthrough bleeding again on my trusty pill. After a few more switches, I realized that the pill just wasn't the option for me anymore. So I wanted to come off the pill entirely and just see what my period was doing underneath after all these years on it and breakthrough bleeding. And I just no longer felt good about the higher and higher estrogen doses that were prescribed to me to try to fix this breakthrough bleeding, which was certainly really inconvenient. I was bleeding pretty much 3 weeks out of the month spotting, but it's annoying. It's an annoying thing to experience when you're taking the pill. So I came off one day and I decided to see what happens. Within 6 months, I noticed much heavier menstrual flow than I recalled. But I thought that's normal. The pill, is meant to give you a lighter flow. It's a withdrawal bleed. So I didn't think too much of that. I noticed each month the pain getting a little more present. Again, nothing too crazy that interfered with my work, but I was reaching for my hot pack and some ibuprofen more each month. I felt my bowels becoming disrupted leading into my period. And finally, I started to notice worsening pain with sexual intercourse. And later on, I started to experience bleeding afterwards too. Plus, I started to experience these zaps of pain that I can distinctly recall my pregnancy clients would often complain about and label as lightning crotch, which prompted me to return back to my GP to discuss these concerns. A new GP. In addition to alternative birth control options. At this point, I was primarily interested in the Mirena IUD, but open to other options. Now, at this point, I was continually becoming suspicious that potentially I had endometriosis. I was working more and more in the reproductive health space and seeing more and more of these types of clients and could relate so much to what they were experiencing with navigating the health system, as well as their symptoms. So I went to the GP, we discussed my concerns, particularly the bleeding after sexual intercourse was a particular concern of hers, and she recommended doing a cervical screening test, or a CST, formerly known as pap smear, on the spot, as bleeding with sexual intercourse can be a potential red flag for cervical cancer. So thankfully, whilst I was clear of any precancerous or cancerous cells, and I didn't have any of the HPV strains that caused a cancer concern, I did have other strains of the human papilloma virus, or HPV. So at this stage, with my desire to get the Mirena, and this new finding, I was sent by my GP to my local family planning clinic to discuss Mirena insertion. So I went off to the family planning clinic. You can see how many appointments, how many touch points, how many times you have to talk to different people and tell your story from the beginning it takes to get somewhere, right? So we're not done yet, but I just thought I'd bring your attention to this. So I went into the family planning clinic and chatted to the nurse, and a couple of things in my history made her ears prick up, and she wanted a family planning doctor to review me, which quite urgently, which obviously raised my anxiety somewhat, but I knew that, if anything was really badly wrong, that they would send me to the hospital, and, if I did have cancer or something like that, it's a very slow-growing cancer, like a few days isn't going to change anything. Sadly, the doctor was unwell on the day, and so I got bumped another 2 weeks. So ended up being a few weeks before seeing the family planning doctor. And the family planning doctor conducted a thorough pelvic examination. I was screened for a wide variety of infections, STIs, pregnancies, all that kind of stuff, which I'd done countless times before as well. And she recommended, based on what she could find, I had something called a cervical ectropion. Now, this is when the cells that sit just inside the cervix, so on the other side of that gate, so more towards the uterus, those glandular cells are actually growing outside, so on the vaginal canal side of the cervix, and it makes the surface of the cervix appear quite red, and so it's obviously quite sensitive, and that could be partial explanation for my bleeding and for my pain, particularly with sexual intercourse. So that was a new finding which she noted, and she also recommended that with my HPV findings that I be referred to a gynecologist who would perform a colposcopy, review my history, and they could then decide whether the Mirena IUD would be the right option for me, or I could return and they could do it, or I could return to family planning for the insertion once they had the sign off. So at this point, not only was I concerned about the ectropion and the colposcopy, although that didn't freak me out too much. At this point, I was decently convinced that it could be endometriosis. I had one of those days in my clinic, which was face-to-face at that point. I just seen client after client after client with endometriosis, and they all had quote-unquote non-classical symptoms, although I don't think there is such a thing as a classical symptom set with endometriosis, in my opinion. But, one client, I only found out about endometriosis when I was trying to conceive and I was having trouble. I only found out about endometriosis when my doctor suggested it could be an explanation for my ongoing issues with fatigue. I only found out I had endometriosis because I had bowel symptoms and IBS-like symptoms. And so I had just heard it so many times, and I'd convinced myself I couldn't possibly have it because my periods, whilst they weren't particularly delightful and I never looked forward to them, I wasn't in debilitating pain. I wasn't bedridden. I wasn't struggling so much so that it impacted my life so negatively that I felt it wasn't warranted to raise that potential flag that it could be endo. But at this point, I had this day in clinic. I was like, nah, this has got to be at least a consideration. So at the time, I was working in the lovely Dr. Natasha Andriadis' office. We've had her on the podcast before. She's an amazing integrative fertility specialist here in Sydney. And I asked her for her recommendation to see a gynecologist and endometriosis surgeon who so happened to be across the hall from my in-person rooms in Newtown. So it's always great when you work in this field because you probably know who is going to be in your business, literally. But, it's their job, and it's just like me seeing them for a consult. It's no big deal at all. And so he performed the colposcopy, and I mentioned my concerns about potential endometriosis. And I remember I was so worried about bringing it up to him because I had this encounter with my delightful GP earlier in the months preceding the trip to family planning. And I said, do you think this could be endo? And she was like, when I was a medical student, I remember thinking I had all these weird and wonderful conditions because I was seeing them in the hospital. But, the reality is sometimes we can liken ourselves too much to our patients and this and that. So what she was implying was because I was seeing so much endometriosis, it could just be some projection on my part. But we all know that endometriosis is not weird or rare or, uncommon in any way. And so this was a very plausible explanation for what was going on. So I said to my gynecologist, these are my key symptoms. And he was like, yep, right away, no worries. Let's take you for surgery whenever you're free. We can do it. Safe to say, I was absolutely taken aback. He was ready to go right away, but I just felt validated that a professional thought that potentially I could have endometriosis all these years, and that thought was not unfounded. He sent me for some additional testing, including an AMH and also a CA125. Now, the CA125 is a particular marker that's typically used in trying to pick up particular reproductive cancers, but it may, in some cases, be elevated in endometriosis or PCOS. And sometimes you can have all of the above, and this marker can be completely normal. So it's not a perfect test for endometriosis. Nothing at this stage is replacing the accuracy and sensitivity and specificity of a laparoscopy with pathology being run on the tissue to confirm endometriosis. So he also discussed with me, once I decided to do the surgery, that we should do a tube flush. He'd also insert the Mirena IUD, and he would also diathermy my cervix due to the HPV and the ectropion all at the same time. So for those who don't know, diathermy means removing the top layers of the cells from the cervix using a heated bull-tipped probe. Yummy. So at this stage, the CA125 came back normal, and my AMH was normal for my age at that time. And I was really at this point starting to convince myself out of it. Internal ultrasounds were negative. Blood tests were negative. Maybe this was all in my head. Maybe I was exaggerating. Maybe this is just life off the pill. Maybe the ulcer in my terminal ileum is explaining it. Maybe it's just IBS. All these thoughts swirling in my mind. And I realized at this point, with thanks to some incredible support people in my life, that I needed to have peace of mind. I needed to know either way. Even if I did the laparoscopy and nothing was found, I needed to know, because at this point it had been years of feeling unsettled, feeling unsure, and I bit the bullet. I scheduled the laparoscopy for December 21st, 2019, because I didn't want to take time off work. I was new into starting a private practice, so I wanted to do it over the Christmas break. I know, Merry Christmas to me. And a common question I get in my DMs is about the laparoscopy itself. So for me personally, I didn't feel particularly anxious about the surgery itself. I trusted my surgeon. I had been under general anesthesia many times before, and I knew what I was in for from my clients: the gas, the shoulder tip pain, a potential recovery period of at least a couple of weeks. None of that really freaked me out. I was focused on what the findings were going to be. And it wasn't the finding of something being there that probably freaked me out, but it was the finding of nothing at all, and spending all this time, money, and emotional energy on it, and looking like a bit of a quote-unquote fool that I didn't have anything wrong with me at all, particularly as a healthcare professional trying to work in this space. But honestly, I just wish I could tell myself this is not about what others think of you, not even your own doctor. It's not about proving anyone wrong or right. This is about your own health, physical and mental, and that is what I should have been focusing on. But sadly, it was not. So what was my recovery like? And I think it's really important. As I said, this is my story. Don't compare your recovery to anybody else's. I have clients who are bouncing out of bed within a few days, and others who need 6 weeks plus to recover from their surgery. It really depends on the extensiveness of the operation and many other factors. So my laparoscopy got rescheduled for 2 days later. So I ended up going in on the 23rd due to an emergency surgery that my doctor needed to perform. And so I ended up fasting of some kind over 4 days, which equaled a very cranky and emotional Steph. If you've seen me hungry ever, you know it. But times that by, many days of fasting. So I went in on December 23rd. I woke up after my procedure. I was in surgery for about 2.5 hours. And I woke up to find out that I had 5 incision sites. And I recall my surgeon saying that I would have 4 usually. So I knew they had found something, but I was not awake enough from the anesthesia to ask questions. I could just hear. And as I woke up and came to again, and my doctor came round, he advised me he did find endometriosis, and he described it like bubble wrap. And he said it was around my bowel, my bladder, my uterosacral ligaments, and the top of my vagina and uterus. But my ovaries, my fallopian tubes were all completely clear of endometriosis, which I was relieved to know. and made sense in the context of not ever having any ultrasound findings. Typically with endometriomas, which are the ovarian cyst forms of endometriosis, you'll commonly see these appear on ultrasound if they're large enough. The marina was inserted, my tubes were all clear, my cervix had a bit of a tune-up, as I call, and he recommended, after I saw him post-op, that we do another cervical screening test or pap smear in a few months to just make sure that the HPV was gone and just to focus on recovering. So at this point, I cried tears of relief. I cried because I wasn't crazy. I felt validated that my symptoms were real, and I had a diagnosis of stage 2 endometriosis, which is mild endometriosis. I stayed overnight at the hospital with a catheter inserted. Now, I know many of you do not like the idea of a catheter, and I was nervous about this too, but I am so glad that the doctor did it because it allowed me to just completely rest that night without waking up to wee. I cannot imagine what rolling out of bed and waddling off to the toilet would have been like. Absolutely not. I ate really well afterwards. I was starving after days of fasting, and I ate well. I had no nausea, no vomiting, no issues there. I never really have had nausea after procedures, even though I'm nauseous going in the car to do anything. But, you know, bodies are weird, hey? Truly strange. The catheter was removed. I was told to wee, and they did a couple of follow-up ultrasounds to make sure my bladder was emptying well. And then I started the very slow process of getting myself ready to waddle out of that hospital on Christmas Eve in my nightgown, in my bloated tummy, feeling like I had done about 1,000 sit-ups and then finally got a kick to the guts. It was just pure, for me, abdominal muscle pain. There was no shoulder tip pain for me, thankfully, and the gas was certainly there, but I did manage fine with some over-the-counter medications, rest, taking my prescribed medications, lots of fluids, and keeping my bowels moving once I got home. I only used pain medication to sleep the first 2 nights, and then after that, I was just taking my prescribed anti-inflammatories and antibiotics I think I was on. I was allowed to use the additional pain relief as required, but I didn't feel particularly pain. I really felt that muscular kind of pain. The biggest thing that supported my recovery, I feel, which I did dread when my surgeon advised it, was actually walking, and walking every day. And I thought it was a torturous and insurmountable task at the time, but it really made the world of difference to my recovery. It promoted blood flow, it got rid of the excess gas, and by the end of a week or two, I was able to get up to about an hour to an hour and a half of walking per day, which sounds bonkers bananas, but it was really my surgeon's, steadfast approach that 10 minutes of walking and adding an extra 10 minutes on each day was the best thing for me. So obviously follow your own doctor's advice for that, but I followed mine, and that was my outcome. So what were my symptoms like months after my laparoscopy? So after I recovered from the surgery itself, I felt pretty good. I felt more energetic. I felt less bloated. I'd also had an iron infusion the previous year, which certainly helped a lot too. My FODMAP issues were had disappeared pretty much. I didn't have pain with sexual intercourse anymore. I noticed other things improving too that I didn't know were wrong before. So every time I sat on the toilet to urinate, it took like 35 seconds to wee. Sometimes I would need to press on my bladder to maintain the stream. And I never really thought anything of that, but it was almost like the urine was falling out of me when I weed after the surgery, and was hardly bloated anymore. It felt magical, honestly. I felt pretty much symptom free, minus that remaining dull right-sided lower ache, which I chalk up to probably my ulcer. I'm not sure if that ulcer is a true ulcer or endometriosis that was attempting to invade the bowel. I don't know. But I would say for a solid 6 months after my laparoscopy, I was fine. And after this, I had some teeny tiny little niggles starting to come into play. And once you get a baseline that is symptom free, any little thing that crops up is going to feel like something, So what are my symptoms like nowadays? So now I'm over 3 years post my first and only laparoscopy to date to remove my stage 2 endometriosis. And I'm certainly not as symptom-free as I once was, but I feel I'm pretty good overall. I rarely, I would say maybe every 3 or 4 months or so, have a significant flare-up. I have light, somewhat regular bleeds with the Mirena IUD. I've learned to manage my pain with sex, and my urine concerns have returned, but I've managed this pretty well with pelvic floor exercises. And whilst my bowels, particularly recently, continue to act up at times, the frequency and severity of these symptoms are certainly not as bad as they once were. So what do I feel day to day? Not too much day to day besides that continuous dull right-sided ache, which I'm not sure will ever go away. It's honestly just background noise to me now unless I really tune into it. My bowels are sometimes overactive with loose and frequent bowel motions, especially approaching and on my period. Issues with urination certainly re-emerged about a year or so ago, and I worked on that with pelvic floor physio. Pain with sex is highly variable and hard to articulate, but overall improved, although sometimes I can be quite sensitive and I can experience a lot of pain. But I do know what works for me now and what doesn't. And again, I've worked on this significantly to improve my situation, which is positive. My period pain has certainly started to creep in. I'm finding the last 6 months or so, and certainly notably since I did my egg freezing in October 2022, I'm noticing I'm reaching a lot more for my hot pack. I'm not sure if that's coincidence or whether the excess hormones stirred things up for me, but I hadn't used a hot pack in years. Like, it was literally collecting dust. But the last 3 or so months, I've definitely had to use it a fair few times, more than usual. I definitely notice when I am ovulating and still on occasion get my lightning crotch or zapping type of pain every couple of months or so. It's very fleeting, but it definitely takes your breath away for a moment. And I do certainly notice some more fatigue creeping in and days of random nausea, which are very new symptoms for me, and I have checked a few times and I'm certainly not iron deficient. So I suspect it's probably related to that, but fatigue is one of the hardest symptoms to really pinpoint what is the cause. But my endometriosis doesn't get in the way of my work, my social life, my emotional well-being, my ability to exercise at the gym. I climb, I dance, I hike, I travel. I don't need pain medications, and for that, I am so grateful. And I know that's not everyone's story, and I'm not saying that to rub it in your face and say, look at me. I understand the complexity and the spectrum of endometriosis, but what I wish I had when I was questioning whether I had this condition or not was stories that weren't debilitating pain and pain medications and bleeding and all these things that are classical endometriosis symptoms. I needed to know the subtleties of this condition. And there are a number of people that are walking around with endometriosis today. A number of you probably listening to this right now that have endometriosis and you don't even know it. I have countless cases where this has occurred, and perhaps the only quote unquote symptom has really been infertility. Or perhaps I've also seen a number of cases where people have gone in for an appendectomy, a removal of the appendix, and endometriosis has been found. And many people are super, super shocked to find that out. So it's never, in my mind, ruled out until it is ruled out. So just because your symptom profile doesn't match doesn't mean the possibility is zero. So what do I do to look after myself with endometriosis to optimize my management and live my life to the fullest? Well, I look after myself. I strive to sleep enough each night, try and move my body regularly, and I've refocused again on strength training twice per week. I eat well. I focus on the anti-inflammatory principles that I've talked about last year, my anti-inflammatory eating for endo episode in the last mini series. And I also shared many of those tips in the masterclass, which you're welcome to join anytime too. I am flexible with my lifestyle. I'm non-restrictive. I did go through a phase where I felt it was necessary or an obligation after I was diagnosed to do gluten-free, dairy-free, soy-free diet. But I use my own body to tell me what's going on, not what is going on social media. And there is no medal for doing the most. So you just need to do enough to get by. And I accept my imperfections. The second thing that I did and do is I see a pelvic health focused exercise physiologist. I talk about her all the time. It's Courtney Pollock from Her Exercise Physiology, who we've had on for a couple of episodes before. And she gave me personalized advice to help my pelvic floor function. She designed an exercise program to help build muscle to support these structures, to allow me to reach my goals of easier urination with less delay, less discomfort, and also pain with intimacy. So we've definitely worked on that a lot. Just an FYI, many people with endometriosis have an overactive or tight pelvic floor. It's very common. It's a body's response to pain to clamp down. So it's always good to get checked out by a pelvic floor physio or an expert pelvic health EP like Court. So the third thing I did was identified my key triggers and aimed to minimize those as much as possible. So my personal ones are alcohol and higher fat foods. So things like deep fried foods like chips and battered fish, fast food, other random things like spring rolls, bacon, and so on. Things that are really high, particularly in saturated fats, don't sit well in my tummy, digestively or with pain. Fourth thing that I do is I use specific supplements to support my endometriosis too, to help with inflammation, especially and occasionally when my gut plays up, I do use other supplements as well. Now, I know my DMs are going to be flooded with, what do you take? Can you tell me what you take? That sounds great. But as a dietitian, we are not allowed to be associated with or endorse a product that is TGA listed. It's a legal and ethical insurance issue. So we can do it in the context of a one-on-one session. And just remember, this is not a monkey see, monkey do situation. Just because my story sounds a bit like yours doesn't mean it's the right thing to do. So we do offer supplementation consults. So if you would like to discuss your supplementation plan, the link will be in our show notes to book a once-off supplement chat. The next thing that I do is I'm kind to myself. I don't blame myself when my symptoms arise, even if I know I have purposefully or accidentally overdone something that I know sets me off. I show myself compassion. I help myself in that moment. I note that experience when I am next faced with that decision to hopefully make a more informed choice next time. I don't live in constant fear of recurrence. I know my endometriosis is probably growing back, but I can't see it, and I've tried since then. I've done deep infiltrating scans and nothing shows up. I accept that I will need more surgery one day, but I am choosing to delay this as personally my symptoms aren't impacting me enough to potentially create more scar tissue at this stage. And I am hoping to prolong this until I am ready to conceive or use my frozen eggs for fertility treatments to get pregnant, to hopefully reduce my total number of surgeries across my life and maximize my fertility without it get out of control or my symptoms getting out of hand either, because my quality of life is important to me as well. What have I learned in the past decade? What would I do differently or tell myself a decade ago? My goodness, so many years of endometriosis and only 3 or 4 of them where I've been diagnosed. So lots to learn for sure. So I have learnt what endometriosis is, how common it is, how diverse it can be in its presentation from asymptomatic to debilitating and disabling. To listen to my gut and my inner voice telling me something is wrong and following that with less doubt. Don't gaslight myself out of receiving good care. Find good people to support you, both medical, allied health, and of course your personal network for those moments you wobble and you do doubt yourself. Be trusting of your qualified healthcare team. But always use some critical thinking skills too. If something doesn't sound right or sounds too good to be true, do your homework, get a second opinion, trust that gut. I feel lucky and grateful to be here where I am. I can do what I want when I want, and I know not all endo warriors are the same. Like I said, I don't just say all this stuff to rub it in your face at all. If you're listening and you're in a position where endo has coloured every element of your life, I am so sorry for the pain, the suffering, and I also want people to know that endometriosis can look like me too, and it can look like you too, and it doesn't have a look or a standard set of symptoms. It just is. And that's what makes it so tricky, but so important to keep talking about it. The learning and the management of this condition does not stop after surgery. Keep going and learning how to manage using all the tools in your tool belt. And I certainly haven't explored them all yet, but I have definitely dipped into a number of different things, and I'm in the fortunate position where I have great connections in this field and I learn something all the time from my amazing colleagues. And finally, I tell myself 10 years ago that I'll be all right. It'll be okay. It does end, and you do get some answers and reprieve and relief. So to wrap up, I don't feel as though my story is very unique or special. I fall into the statistic of having a significant delay from symptom onset to diagnosis, but not as long as many others. My symptoms may not be as typical as what you may think endometriosis may be, but many people have asymptomatic endometriosis or have subtle or quieter symptoms that are hard to pinpoint and hard to make you feel confident that it might be endometriosis. If this is you, I just want you to know I get it. I see you. I know it's really easy to almost gaslight yourself. As a society, we have normalized people being in pain, especially those that are born with a uterus assigned female at birth. And it's not normal, and you don't need to put up with it. I know we talk a lot about not being heard by healthcare providers or being told it's fine and normal, but I can tell you, I've met them. They're incredible healthcare practitioners who do listen, who do want to help you. And finding them can be tough sometimes, and it shouldn't be, but it is so, so, so worthwhile. So I hope this final episode of the Endometriosis Mini Series has resonated with you in some way. Please come and chat with me at endo.dietitian for my endo account, or at @the_dietologist on Instagram if you want to chat some more. I am pretty much an open book with the subtraction of course, some medical things and supplements and things that I can't disclose. Thanks again for tuning into this episode. And if you do want some one-on-one support for your endometriosis nutrition path, don't forget we do have openings each and every month to our endometriosis nutrition coaching program, a bespoke 4-month one-on-one experience combining Zoom consultations from anywhere in the world, online learning, and weekly support from a trained endometriosis dietitian and nutritionist to support you with your endometriosis related goals. We use our signature approach to focus on inflammation, to reduce pain, hormone health, and gut function to improve your quality of life. We combine science, practical tips, and of course, a big dose of compassion to help you tackle those bothersome symptoms. And we would love to chat with you and support you. The link is in our show notes to apply to work with us inside our endometriosis nutrition coaching program. And I would love if you could follow us on Apple Podcasts, Spotify, wherever you're listening to this podcast, whatever app you're listening to, hit follow, leave us a 5-star rating and review on Apple Podcasts, or a 5-star rating on Spotify. This makes such a difference to our podcast. And don't forget to share it with someone who you think would find it useful, and post it to your stories, tag me. I love seeing your posts. Anyway, I did not intend to talk about myself for an hour, but here we are. So until the next episode, everyone, bye. Fertility Friendly Food, the podcast, acknowledges the traditional owners of country throughout Australia and recognises the continuing connections to lands, waters, and community. We pay our respects to First Nation cultures and to the elders past, present, and emerging, and extend that respect to all First Nations people tuning in today. This podcast is recorded on the land of the Gadigal people of the Eora Nation.